So the first thing we're going to do is check the MAR for the physician's orders, the type of NG tube we're going to be placing, and the purpose of the tube's placement today. I'm going to enter the patient's room and pull the curtain closed for privacy. I'm now going to wash my hands and confirm the patient's identity using 2 identifiers, such as their name and date of birth, and explain what I'm about to do today. We're going to review the client's history for any conditions that would impair the placement of the NG tube, and we're going to assess the patient's level of consciousness, ability to cooperate, and their ability to move into the correct position. I'm going to assist the patient into high Fowler's. This is Gladys. Hello. And I'm going to assess their pulse ox and vital signs and record that information. Now I'm going to assess the client's nares and oral cavity, which look good. Today, I would be looking for deviated nasal septum, any signs of nasal surgery, the ability to breathe well in and out, if anything is occluding the nasal passageways, such as irritation or bleeding or anything like that. I would assess their ability to cough by holding a napkin in front of them and asking them to cough. I would also stick a tongue blade into the back of their throat to assess the gag reflex. And now I'm going to put on clean gloves and prepare my supplies. So the first thing I'm going to do is measure the estimated length of the tube. We're going to measure from the tip of the, artist's interpretation here, right? So we don't have all of the correct anatomical parts, but we got the important ones. I'm going to measure from the tip of the nose to the ear, which I'm going to imagine is like over here, and then to the xiphoid process, which would be for Gladys like right here. And then I'm going to mark that place with a piece of tape. And now I'm going to put that down for a second. I'm going to grab my syringe and sterile water and draw up 10 milliliters of water. Okay, put my sterile water to the side. I'm now going to connect the syringe to the tube. My finger. I'm going to flush this into a trash receptacle with my 10 milliliters. I'm off camera, I'm still here. I'm flushing this with 10 milliliters of water into a trash receptacle and putting that syringe to the side. And my tubing is now primed and ready to go for insertion. I'm going to lubricate the about 4 inches of the tubing of the distal end in a water-soluble lubricant. So let me grab that. And then I'm going to roll it I'm going to roll the 4 inches in the lubricant. This is a clean surface, by the way, wouldn't be my kitchen counter. Roll the tube in the solution. I'm now going to tell the client that I'm going to insert and ask them to extend their head back against the pillow. Again, this patient should be in high Fowler's position. I'm going to slowly insert the tube through the nares, curved and pointing downwards towards the ears. If I meet any resistance, I'm going to apply gentle pressure downward and advance the tubing. We're going to insert till we reach our desired spot marked on the tape. I'm going to ask she's falling. I'm going to ask the client to bend their head forward. She can't do that. Chin to chest and swallow. Keep swallowing, and then I'm going to advance the tubing with each swallow. And again, this is until I reach the tape. If any gagging or coughing occurs, I'm going to withdraw the tube a little, allow the client to rest, and continue again to advance. We're going to advance until the tape mark has been reached. which is right there. And then I'm going to temporarily tape this. Technical difficulties, you know, nurse life. Temporarily take this to the client's cheek. Okay. I'm going to check the placement of the tube. I'm going to ask the client to speak, see if they're able to speak, and inspect the posterior pharynx for presence of the coil tube. So I would check in there, use my pen light to make sure I see the tube and there's no coils present. If indicated, we would attach the catheter tip to a syringe at the end of the tubing, and aspirate gently back on the syringe to get gastric contents and observe the color and contents of those, and send that for pH testing, but that is not needed today. Next, I'm going to make sure my tubing is clamped. And then I'm going to mark the location of the exiting part of the tubing with a marker, and my exiting side. So this is the exiting side. And I'm going to anchor the tubing to the cheek with a temporary membrane. Which I have over here. I'm going to remove my temporary tape carefully. This Gladys is fragile. And adhere this again carefully because Gladys is fragile. Adhering this out of the patient's sight comfortably. And then removing. I don't think Gladys can handle the stress of me taking off that white paper tape, but that would also be coming off. But you know, you gotta look out for the patient and don't want to put them under unnecessary stress. So this is gonna stay on Gladys, but in real life, that white part would be removed, and again, the edges would be carefully sealed. And then I would fasten a rubber band to the end of the tube in a slip knot and pin the rubber band to the client's gown. So imagine, you know, down here, the client's gown, and making sure that there is still enough slack in the cord to have the patient move her head. And now I'm going to remove my gloves, perform hand hygiene, and put on clean gloves. I would, if we had a suction device, I would now keep the head of the bed elevated to at least 30 degrees unless otherwise indicated, and I would attach the NG tube suction to the suction source and establish suction I would establish suction at a low intermittent setting unless otherwise ordered. And I would clean the nair that I inserted that tube into, and then I would also perform an oral hygiene, and I would re-perform oral hygiene every 2 to 3 hours. I'm now going to gather up all my supplies, and I'm going to remove my gloves, dispose of those as well, and I'm going to perform hand hygiene again. We're going to assess the patient's comfort level, assist them into a comfortable position, document the procedure and outcomes, and how many milliliters of sterile water I used, which is 10 milliliters. And I'm going to place the call light next to the patient's bed. Side rolls up ×2, bed in the lowest position, except, you know, keep the head of the bed elevated, and ask them if they need anything. Thank you.